a well overdue conversation tonight on the Chronic Pain Club and also Joel Nelson podcast, as Dr. Simon Stone is an award-winning medical communications specialist and patient advocate, and somebody that if you are generally involved in the arthritis and autoimmune space on social media, you could not have missed, I don't think, by now. Simon, thank you so much for joining us and welcome in.
No, thank you so much for having me. It's long overdue. So I'm excited to be here.
Yeah, it really is. It feels like a lot. Well, I think it's way before most people I speak to on here. It's like, oh, we met over the pandemic. We were, I think, pretty much before that.
Definitely.
Yeah. And we're finally on a call, which is mad. So just on the off chance anyone's watching this who aren't familiar with you and your work, do you want to give us like a bit of a high level, who you are, where you're from and what you do, and then we'll dive into the sort of medical side of things?
Yeah, absolutely. So I'm Simon Stones. I am from a place which you might know near Manchester called Bolton. So Peter Kay, Vernon Kay, lots of other famous actors and individuals. So it's quite a small place, but lots of big people. So I'm born and bred in Bolton. I'm a local boy. I obviously have a variety of different health conditions, including juvenile arthritis, psoriatic subtype, and Crohn's disease, and various other things along the way. And really, my experiences made me interested in health, in medicine, in research. And so went to university planning to do teaching. And this is, I think, how research can change lives. I was planning to teach biology, got excited by research at uni. Very long story short, I ended up doing a PhD looking at juvenile arthritis. And now I work in medical communications, where I get to blend all of my experiences of being a patient, being a carer, being interested in loving science, but also really cautious about making sure we involve patients and carers and family members in everything that we do, because when we work together with all our different expertise, that is when the magic happens.
Brilliantly said. And I'm sure as we talk through tonight, people will realise how having that foot in both camps and that interest it really is what makes you such a sort of phenomenal figure and force in the community. And also so very few people are involved, I feel like, on that sort of scientific and research side. You know, like there's lots of us sharing our stories and doing things like I do here tonight. But I think it's really important for people that sort of angle towards that. So that was something, research and that and the science stuff, I suppose, was something that always interested you by the sounds of it.
Yeah, and I think, when things are being done to you as a child, and things have changed a lot since the 90s and the early noughties when I was a child living with juvenile arthritis, and there's lots of, things being done to you, and I started to become inquisitive of why do I need to take that? Why do I need to have Emla before an injection? Why is this the case? Why can't I be like my friends? And so there's a lot, that is the fundamental crux of being a researcher. You ask questions to find out whether the hypothesis is correct or not. So really, it was always there. But I think, and I presume many people will be able to relate to that, because for me, it's rather than just saying, well, you're having this, I want to understand why and the implications of that, because that is the fundamental basis of shared decision making, that we actually are informed by what's happening, what we can and cannot do, and what we can control. So I guess that's always been there. And I feel I was very, very lucky to have two parents who were very supportive of that. And particularly my mum, who my mum passed away 5 years ago, but she had lots of lived experience with autoimmune rheumatology conditions and various other things as well. But she was, from a very young age, she was very upfront with me. And I remember asking, I was in clinic and, it was 5 o'clock. They didn't have time to put the Emla cream on before to have the injection. And, my mum had mobility issues, and it would mean them coming back the day after. It would be difficult. And so she said, it will hurt, the injection, it will hurt, but it'll be short. It won't last long. And it was the honesty that I had trust in my parents. I had trust in the health professionals. I really, I think it was about the age of 6, and never had Emla cream again with taking through a blood draw. So I think all those, there's lots of different factors which influence, and, having good healthcare professionals who talk to you as a child, you are aware of what's happening. And if things are explained in a developmentally appropriate manner, then you help to overcome some of those issues, which could become issues later on, simply because the truth has not been told, or we've glossed over certain facts. And that's so important that we acknowledge that, and we try to be honest and supportive to people of all ages with chronic conditions.
I find this fascinating. In my head, I'm already seeing like this mini series because it's like you're the first person I'm pretty sure that has come on with the exact same subtype as me. So we've had lots of people with psoriatic arthritis on the show. We've had lots of people with JAA, but I don't think I've had anyone else that's with the psoriatic associated subtype and had the onset as a kid like you did. And my experience was very different. I'm clearly a bit older than you. And, lots of them things, I think what you were saying there, which really stuck out, is like lots of things that happened to me on my own, where I'd be admitted to the hospital for a couple of weeks and my parents couldn't be there every minute of the day. There wasn't such things as facilities for them to stay and all this sort of thing. And so those tests and trials and drug trials and various things and them sort of horrible experiences that stick with you. I was kind of doing that on my own and nobody's really explained that to me. And then the end result of that was kind of the opposite to you, where I shut off and didn't want to understand it, didn't want to know about it, kind of tried to bury it and forget about it. And it took becoming a dad when it all came out like mentally badly and I then had to deal with it, and that's then what led me to advocacy, to start asking those questions. So I find that amazing. I think it's a really important point that because you had that support not just from the medical team but your mum, and I remember being in contact with you when you lost your mum, and it was so clear that she had a huge role in all of that. And I just look at that, how you get it. We both ended up in the same place, but we both went two very different paths because of the support we had. And it shows how important those early experiences are, doesn't it?
Absolutely. And I don't think we don't look enough at that, the support that's in place. And it's all the different factors, because it can just be one thing that's missing, and that can have such a lasting impact on, health, how people cope, and various other outcomes as well. So it is bizarre when you look at it, when you pinpoint it out like that. It's it really stark. You see the difference.
Yeah, and I think that's why it's really important we have these conversations, because it's not just about what's happening here and now. It's about that journey, isn't it? And you must have experienced it. How I don't know if you said or if I missed when your onset was or when it was diagnosed, but your relationship with arthritis must have changed through your life. You start as a child and you go to university and then you're trying to have a career and did you find that the support was there as you transitioned through them sort of gates in life? I can't really think of a better way to put it. Or did you find it was kind of that you had to sort of get there on your own a little bit?
I mean, a bit of both. I mean, I wouldn't say they were gates. I probably said they were huge, big jumps over cliff edges, to be honest. And it may.
I didn't want to be too leading.
I'll say it as it is. When I think back, at 18, I hadn't sat down and had a conversation with another young person with arthritis.
Yeah,
and I think that we still see that today. I think it's happening less because there are more of the charity sectors doing wider reach out. Social media helps with that. But there are still people who do not have that conversation, maybe because they don't have access, maybe because they don't want to, or maybe they're just not sure on how to take it. So for me, my childhood with arthritis was lonely in the sense that I didn't know what it was like to be to know another young person with the disease that I lived with. I guess my circumstances potentially slightly different. So I'm going back to very early days. So I said my mum had lots of conditions. So she had lupus, she had a muscle disease called polymyositis, she had osteoarthritis. I mean, the list goes on. Probably the whole textbook, the whole rheumatology textbook my mum had. And so my onset was noticed by my mum. So she bypassed the primary care route, which she would tend to go down. So there was two signs. So I had a hammer toe and I had my fourth finger on my right hand where it was inflamed. So my mum actually took me to her consultant rheumatologist. And so my mum had which I think, back in the 80s, my mum was very poorly at one point, and to the point where the rheumatologist sat by her bedside all night.
Oh, wow.
Very different world to now, but they had a very close relationship in that sense that he truly cared. And without him, my mum probably wouldn't have survived. So she had that relationship. So she treated me. She just said, I've just noticed this, because my mum was always thinking, is there some hereditary component here? And he actually then referred me directly to one of his consultant colleagues who was a paediatric rheumatologist. So I ended up going to, sadly not down there, but Pendlebury Children's Hospital near Manchester. And actually I requested my medical records about 5 years ago.
Yeah.
And it's fascinating reading like a big stack like this.
Yeah. I bet you're like me. You always know when you're next to be called in because of the pile on the trolley outside the room.
I didn't realise how much. And what? There's a lot of stuff which I obviously don't remember. At this age, I was 3 years of age.
Okay,
I don't really remember this. So I personally do not remember life before chronic health conditions. I don't remember that at all, which you could say is a blessing, essentially, because I had nothing to compare against. So that is my baseline. And so they were initially looking to diagnose me with a fibrous dysplasia. So they thought it was more not inflammatory, but more on that side, looking at, potential skeletal abnormalities, muscle related. So I didn't realize all of this happened. And when I've gone through the records, I went through various different, it is inflammatory, it's oligoarticular. So, couple of joints, and then it was extended oligo, and then it ended up being psoriatic arthritis when I was about 6 or 7, and that's obviously the diagnosis which is retained with me into that's another topic when we get to adulthood, and then slight changes need to happen to make sure you access treatment. So that was a diagnosis that then stayed with me, but I went through periods where probably wasn't doing too bad. So between 3 and about 7 I was treatment 3. So it was managed with physiotherapy, occupational therapy, and it seems to be managed that way. And when I was 7, and this used to be a recurring pattern, I used to get really bad tonsillitis. So I was 7, got really bad tonsillitis, and literally every joint in my body just swelled. So my knee was like a football. I was unable to walk. I had to actually go in under general anaesthetic to have all the joints drained and then steroid injections put into each joint. And then that was a recurring pattern then. And that's really when it was difficult to get the disease under control. I'd repeatedly had tonsillitis, which could be 10 times a year. Yeah. And if I didn't receive the appropriate antibiotic treatment, it would go to a joint. And we had this constant back and forward. And that's when I started cycling through all the different disease modifying treatments. And that really lasted for a good 5 to 6 years, until I was non-adherent to the particular treatment. And many people will be on it, methotrexate. It works for lots of people. For me, it didn't work. I had really bad side effects, and I ended up non-adherent. Not trying to admit it as a child. You try, and that's probably maybe chat about that in a bit. But all those issues. And it was at that point, I remember saying to my consultant, and my consultant in this period was incredible. I have to get a shout out to Dr. Eileen Belden. I've had the pleasure to work with her since. She was incredible, and I owe a lot to her. And I remember sitting there with some of who are now consultants, who were like trainees, which is quite lovely to see. And I remember saying, I'd rather be in a wheelchair for the rest of my life. I cannot live like this. And very long story short, I managed to get access to biologics, and which is 20 years ago. It's my 20-year anniversary of biologics this year. And my life transformed with access to biologics. I went from having to use a wheelchair to get about to being able to walk, free of pain, free of nausea and vomiting. It was life-changing. And my life changed since that point. Until more diagnoses came. So I got Crohn's disease when I was 14. and so there's lots of all these pitfalls. And so the point I'm coming to is when you get to transition, you seem to be right. We've dealt with the arthritis, we're dealing with the Crohn's, and then you get shot into adult care, which is a very, very different setting to paediatric care. And
very.
And I think that is when the gaps fall. And I feel like I was reasonably lucky to be feeling reasonably informed, quite proactive, having had the experience all over those years of knowing things to do, things to ask. But that care changes so much, and I struggle. So for people who maybe are more newly diagnosed or who don't have the right information or the knowledge or the support to be able to access care, you can see why, people go to university, they don't go through regular follow-ups, they don't have the treatment, and then will relapse and go into really big flare-ups and have potential lasting consequences because they're not in the right place and have not got the right support. So there are lots of those situations. And I think, in the years later, like access to care has changed beyond measure. I am really worried, and I know we'll probably talk about this a little bit, where we are at the moment, because it is really, in terms of a system and a service, it is really, really challenging at the moment.
Yeah, and somebody worked in the NHS and has done for a number of years. I can see both sides, and both sides are equally harrowing. And I think that's why I don't make a lot of friends on social media in certain communities around my views on PIFU and patient-initiated follow-up, because I think as someone who's gone through that juvenile arthritis to adulthood and that massive jumping off a cliff, and you are about the third person that's come on this show and explained that transition as jumping off a cliff. Without educating anyone, and after spending decades of not letting patients really have a voice or be involved and shared decision making, everything, all of a sudden then they've got to know when to ask for help and try and navigate a system that's so broken in terms of access and that help. It keeps me up at night. Generally keeps me up at night because I know how I felt as that 18-year-old who had to go into my rheumatologist's office for the first time on my own after having most of my childhood not been asked what I wanted or not being involved, and suddenly I'm on my own and I'm looking around and there's no one to say what I need, and that's going to feel like that for a lot of people. So it's a really worrying time, and I think what I would say though, Simon, is it makes people like yourself and what you're doing so much more invaluable and important, and don't stop, despite I know how demoralising it can feel, and trust me at the minute.
I think you and me know we both of us will never stop. So.
No, I don't think we can. However detrimental to our mental health it might be, but you go back like 5 years when we were doing this, and like you can see all the little lights in the tunnel, and suddenly all of the landscape changed, and it's hard work. So one thing I just want to ask you before we get onto the advocacy bit is talking about transitions and pitfalls and things like that. Maybe you were because of your mother's situation, but were you aware that these other things could come along and comorbidities? Because in my journey, that was the thing that really, wiped me out from a blind spot, in that nobody told you, you got arthritis, but you can also get psoriasis and high cholesterol and depression and problems with bowels, and all this sort of thing. And nobody prepared me for that. And obviously you've gone for a similar thing where it unfortunately come along a little bit like pus, like autoimmune disease does. How prepared were you for that, and then to know to look for the signs?
Not at all.
Oh, okay.
In short. And that is one of my big concerns, always has been and always will be, is that, we don't want to scare people by saying you have an autoimmune disease. It means you could get a whole rift of other conditions, because that is not necessarily the case. But I think there are, and I think particularly with psoriatic arthritis, there are certain things which you need to be aware of. You know that you are at increased risk of cardiovascular disease. And I am 100% all about prevention and early detection. So if we know there are, and the evidence is very clear that there are certain comorbidities with psoriatic arthritis and other rheumatic musculoskeletal diseases, people should be aware at the right times. Maybe at diagnosis, that's not necessarily the right point to then say, oh, by the way, we need to be doing this. Well, there are appropriate time points when people have the right information, support, and, self-efficacy in place, that they are equipped to be able to manage the condition, that we actually need to have those conversations to say, actually, and I get really annoyed with psoriatic arthritis. Psoriasis is like the lower rung on the ladder. We don't talk about psoriasis. It's all about the joints. But actually, the psoriasis symptoms may be affecting him more than the actual joint symptoms. That's certainly the case for me.
Your confidence, if anything else. Do you know what I mean?
Absolutely.
I try to have this conversation with people to say it doesn't matter how big the rash is or how visible it is. It's how it makes me feel. You know what I mean?
Oh, I remember being in school, and at that point in high school, my joints were reasonably okay. I was in remission, minor flare-ups, but it was my skin. My skin would pop and bleed in class, and I used to be covered in plasters. You used to hate it. I'd literally be like sitting on my hands, or trying not to show my hands to other people, because I was ashamed of what it looked like. What kids are like, oh, it's infectious, I'm going to catch something, all those kinds of things. It's horrible. And it's just, they hurt as well.
It's totally underestimated how much it hurts.
It hurts, but it for me, it was always like, I don't like the way that my hands look. They look ugly. Now, that's a really important thing for me, which if I could have got treatment that would have helped, that 100% would have been amazing. But that wasn't necessarily the priority for the clinician, because, well, your inflammatory markers are low, so it's okay. Well, no, it's not okay. That's not right, because we need to be looking at people as a whole, not just clinical outcomes.
Yeah.
So it's all part of, the evidence is very clear. Holistic, we need to be holistic. We need to focus on everything. But the translation to reality is far from where it should be.
Yeah, no, that's my biggest bugbear. The whole, we look for people for a focus group, but you have to have, moderate to severe skin disease coverage. Well, no, because that's only taking a section, and it might be a section where maybe people aren't adhering to treatment or don't have access to treatment, and it skews everything. Well, you'll know this more than anything from your scientific sort of background, and that trying to get people to understand that it's not how it looks to you or what it says on a blood test, because I've always had low inflammatory markers, always. It took me forever to get diagnosed because of that reason. And if I had a pound for every time an appointment started with, well, your blood tests look okay, so, and then from that point, you waited 6 months for an appointment, and within 7 seconds, okay, well, I'm not going to get anywhere with this, because they're already made up their mind that everything's well managed. But it might not be for you, it might be how it's making you feel or how it's affecting your work or relationships. And we definitely speak the same language on that one.
And that should be the conversation. And, this is not to put blame on health professionals, because, health professionals are time constrained, and there's lots of other issues at play. But the first conversation for me should always be, how are you doing? And to genuinely mean that, and then to begin with that, and then work around, okay, what are the joints like? What is the skin like? How is everything else doing? Let's check X, Y, and Z. That for me, that is the approach. And you do see that, but again, it's inconsistent, and it's that lack of consistency within centres, but then across the country, in different countries, that inconsistency, which is letting us down.
Yeah, and in the UK over recent years, or England especially in the recent years, how regional that can be as well with the way the system's now set up. It's just, I'm sure you're in the same boat, but I find like I'm a bit of a collector of experiences now, where the amount of stuff that comes into your inbox, and you get a real idea of where the pain points are, and it still surprises me, it still shocks me how I can have a challenge in Norwich and in London it's just not an issue, or vice versa. And how do we advocate for that? I don't know, because it's on such a micro level now. It's really challenging, isn't it?
I know, but there is that need for, you can understand the importance of like localized care and community care, and that's right. But we need to have, it needs to be integrated, it needs to be joined up, and it needs to be consistent, because it should not be a postcode lottery. And that's what really hurts me in terms of health, equity. No matter where you are in the country, you should have access to the same level of care and support wherever you are, whatever your background. And our politicians need to hear that. It's got to come down to them. I think our health workers know that. But it's down to the leaders who really have the ultimate authority to begin to make these changes. So hopefully some of them will be listening back to this, because they need to talk with patients, and not just talk, but actually act on what's being said.
Yeah, that's why lived experience is so important, because only you can talk about those moments where it's like jumping off a cliff, and or them experiences you had, and as much as we've got lots of people sort of trying to do good and trying to raise awareness, and without that lived experience to back up what the real, what it was like to actually live it, I think that's the really powerful thing. And I always say, like, you stick up people like you and me and some of the people I see in chat tonight in front of those decision makers, and start pulling on them heartstrings. I think that's generally where you get change, isn't it? Because you can appeal to the human side in anyone. So I suppose that probably does bring us naturally onto the advocacy side. And you can tell what sort of people we are, Simon. We've just been talking advocacy the whole time, even though we're supposed to have been talking about your health journey. We're just sort of naturally talking policy instantly already. So obviously you were, and I'm embarrass you a little bit here, because when I first started doing this, you were the first person I ever met, genuinely. I had gone, ever since I was a child, hiding my condition. I don't hide the fact that I did that. And, again, I think the way the system was kind of led me to that. When I was ill and in a wheelchair, I hid away, and when things were good, I pretended that never happened and tried to rebuild my life until it went wrong again, and so when I finally decided to start sharing this stuff around about sort of 2018, 2019, and I'd done this like little blog, there would be various people on there in the comments and stuff. And I remember clicking on your name at some point. So you must have commented on it at some point. And I was like, I'm going to try not to swear and say, like, oh my God, this guy, this guy is doing the same sort of thing as what I want to do. And it just blew my mind. I must have spent hours looking at your blog and site and doing a little bit of social media stalking, sorry. And only to find that you were literally this like absolute perfect sort of image of the thing I thought needed to be done. So firstly, thank you for that, because I genuinely wouldn't be sitting here today. I just wouldn't. That blog would have still been sort of semi-private and not shared with anyone if it wouldn't have been for us crossing paths. And also just to continue inspiring me. Like every time I feel like I've had a little bit of success or a breakthrough, I look across to see what you're doing, thinking, "Wow, that guy's absolutely killing it." So yeah, I'm gonna stop embarrassing you, but I just wanted to get that in there because it generally is so important to my story and my journey that if I wouldn't have come across the work you're doing. But maybe you want to tell people how you got started on all of that.
I will, yeah. So like I said, I'd never met any young people before. I was 18. I was actually invited back to Manchester. So this was when I transitioned to adults. And the paediatric team very nicely put together this little, it was like a Saturday afternoon meetup, and there was parents and young people there. And I was so excited, like to chat with other young people, just talking about our experiences. And it was just amazing. And obviously that was my real first experience of peer support. And they asked me the consultants asked me to give like a short presentation. I think I was applying for university, and there was some younger children there as well, and they wanted to try and give them a little bit of hope. So that was like the early days of seeing transition coming into reality. And my former consultant said there is a clinical studies group which was funded by what is now Versus Arthritis and the National Institute for Health, and it was National Institute for Health Research, NIHR as most people will know it. And it was this clinical studies group, the paediatric rheumatology across the UK, that prioritised the research that researchers should be trying to look at. They'd had 2 parents on that group, but they'd never had a young person. And so, Phil Riley came and up to me and said, "Would you consider applying?" And I was like, "Well, I don't really know what to do, but yeah, I'll give it a go." No idea. I applied, and so they said, "We'll put you in touch with the NIHR Patient Public Involvement Officer." I'll have to give a huge shout out because she's really the person that got me involved in research, and that's Jenny Preston. Lots of people I'm sure will know Jenny. She works at Alder Hey Children's Hospital. She's incredible and very active in patient public involvement, and just a really lovely person who wants to equip young people with that knowledge and that the skills to be able to get involved in research. So Jenny helped me to do that. And I joined the clinical studies group in 2012. So I was actually I was 18 at the time, joined the group. And I remember going to my first meeting, and it was held in Manchester. So I thought, great, I got a little overnight stay at a hotel. It was all new to me. It was all exciting. Like I felt important. And I remember sitting in the meeting, and so one of the parents who was in attendance was Sharon Douglas. Sharon runs a charity in Scotland called SNAC for children with arthritis. And Sharon was, again, hugely supportive, very well informed and expertise as a parent. So she was hugely important, and she met me before and, just gave me a bit of a sense of what the group is. But I remember sitting in the room, and there was like 30 people, mostly, rheumatologists, paediatric rheumatologists, got physiotherapists, trainees, you had Sharon. And I just remember sitting through the meeting, going through an agenda, and it was all new. It was all new stuff, talking about, biobanks and this kind of research. And I think for the first morning, I didn't even say a word. I didn't know what to do. The chair was Michael Burrison, again, an incredible researcher and paediatric rheumatologist. And he was very good at asking me for my input, but I didn't know what to say. I felt, nothing important to say. They all know what they're talking about. What's my job here? And it was a little bit overwhelming, but I think, the support that they had, and there was such a lovely group where they actively made an effort to reach out, even if it was in the coffee break, saying, "Well, what did you think about that?" And then they started to tease that information out, that lived experience, and give me okay, actually, I have a role here. I had something really important to say. And that was really important. But that was my first ever interaction as a patient advocate. At the time, I didn't realise that I was called a consumer representative, which is not the nicest term.
But how important was that
the premise was there.
experience? Do you know what I mean? How important was that first experience that it wasn't a tick box thing, which unfortunately we do still encounter, many of us. And I was saying now that I can know in 5 minutes if I'm here because they needed a patient tick or because they the fact that they appreciated it could have been intimidating. They teased that stuff out. They were genuinely looking for your view. And then look what that led to, Simon, and if that would have been a different experience, who knows? Maybe you never sort of said yes again, So it's really important.
I know, there could have well been. I could have, turned around and said, actually, this is not for me. I'm not going to do it, and I probably wouldn't have ended up having my job, doing advocacy. It is bizarre, and I'm sure you will relate to this. But it's all about the people that you meet. And you meet some people who you maybe think, I'm not going to work with you, or you realise that actually this is a tick box, you don't genuinely care. And with confidence, you can walk away from that in time. Yeah. I'm happy to admit that I've done tick box exercises thinking, well, no, I need to be here, it's important. Actually, sometimes it is better walking away because there's going to be no real driven change.
It takes a long while to get there, though, doesn't it? It does take for way too many years. I did things that left me feeling used and dirty and cheated, or I saw my name and image used to sort of support something which I wasn't really involved in. They just wanted to have a patient face or name next to it, but it takes a long while to get past that. Because I'm sure you experience it. Where it's very empowering, that feeling. You go to them things and they're terrifying at first, and then, like you say, you come away and it's exciting and empowering. It's like, oh my gosh, these people actually care what I have to say, and finally someone's listening to what that experience was like for me. And it's like it's a bit of a drug, it's like it's a powerful thing.
It's addictive. It's addictive. And really from that those first meetings on that clinical studies group, one of the members was Professor Helen Foster from Newcastle, paediatric rheumatologist. And she again, it's all these interactions with people that lead to these different paths that you go down. So I remember her saying, it's 2013, she said, I'm setting up this task force with EULAR. So that was my first introduction to EULAR, creating recommendations for transition. And I want you to be one of our patient partners. Of me? Like me? Really? And so she got me involved in that task force, which led to my work with EULAR, which we'll touch on shortly. And then very similarly, there was another researcher who came to the group wanting to look at developing mobile applications for children and young people with rheumatic diseases. Professor Veronica Swallow, who's currently at Sheffield Hallam. And Veronica was lovely and brought me into that team. So she was at the stage of design. What do we do? So she brought me in. She made me co-applicant on the grant. She made me a co-researcher. And that was where I got my first publication, my first conference presentation from that work, my first publication in a peer-reviewed journal with her.
Amazing.
And then she became a PhD supervisor. And it is all, I find it amazing, like just one single interaction can transform what you do moving forward. And for me, it's all about meeting those people who are like-minded, who care, and you can see straight away where they want to genuinely collaborate, they want to do things for the right reason. And I just feel very blessed to have been able to meet those people, and they've shaped my life. It is those interactions which, when you sit back like now, it's like, wow, yes, like I am so lucky that happened, because if I wasn't there in that period, in that moment in time, then so many other things would not have happened.
Yeah, and it's really special, and those people are really special. Unfortunately, they can be a bit few and far between. And I had a similar experience where I went to Italy 2 years ago, and I was right on the verge of I'm done with this. Like, again, bad experiences and everything else, and we want you to write this, but we're not going to give you any compensation for your time, and we're not going to credit you. And I'd done some involvement in some research stuff, and my name wasn't on the papers, all that sort of thing. And then you go there, and you every now and then you'll cross paths with special people that really do believe in the same things that you do, with patient involvement and shared decision making and all them sort of things, and co-creation. And I come away from there just a different person. I think my wife probably saw a change when I came back from that, and I was like, right, I now know what I want to do. I now know what I'm not going to do, but I also now know what I'm going to do. And it's really powerful, isn't it? It's really powerful.
100%.
And sometimes it can feel like we're kind of like shouting into the void or preaching to the choir. And I think it's probably a good time to sort of remind us, even if you just need this today, so if not anyone else listening to this, is like, it does have an impact, because there's definitely been times where, well, like I say, crossing paths with you elevated then what I wanted to go on and do, or what I did do, or times when, projects have happened because of, our relationship, or, recommendations and things like that. And it might feel like sometimes we're not having an impact, but you never really know where that message is landing and who it's helping, do you?
No. And I think sometimes when you get drilled down with the day-to-day, advocacy can be a full-time job. It's draining. So when you're doing that, and you're probably, working as well, and you've got a family, and you've got your health conditions, you do think, and I very occasionally will think, why am I doing all of this? Like, why am I putting myself through this? And then I will have an interaction with somebody, and I'll have messages for over the years, and somebody said, oh, that thing that you posted like 10 years ago, like it just transformed my life. And I'm like, oh God, like it really, I feel really humbled by those interactions. And you don't want to hear it because you don't want anybody to be in that situation, but it's just that constant reminder of, this is important. This is why I do what I do. And when I go to meetings and when I do, online events, I get that buzz again. And sometimes you need it when you're drilled down with day to day, all the challenges that we've got to face day to day. You are just reminded of why we need to exist as a community. Realistically, there shouldn't be a need for advocates, but there is going to be a very long need for advocates. We shouldn't exist if the right scenario was there. But unfortunately, it's not. So we have a really important role, and I guess what I'd seen lots of advocates over the years, and some good, some bad, and I think that's okay to acknowledge. And what I don't like is competition. Yeah. We are all people with lived experiences. No condition's worse than the other. We all have valid experiences that need to be heard. Nobody's more important than others. And sometimes it can feel like that when you see, your patient leaders who are, in organizations and doing that kind of work. And then you're maybe a newly diagnosed patient or a carer. And you think, what do I bring? Well, you bring an awful lot. And it's important to realize that all those experiences matter. And just because you maybe have less experience in a certain setting, or, you don't know the jargon, the, clinical research, doesn't matter actually. What matters is your perspective and what you want to do. And so I feel like every opportunity to get to say that is like, there's no need for competition. No. Let's scrap that, because we all have a right to be heard, and everybody needs to be heard. And the more we do together, we're such a powerful community when we do that. And that's broadly the case. But there are ones that can take one or two situations, and it can be really off-putting. And I've noticed that over the years where I think, right, I'll take a step back then. But no, actually, please don't do that. Do what is right for you, but you've got to keep speaking up, because it's so important.
Yeah, I think that's really important. And unfortunately, we live in an age of social media which kind of tries to facilitate that sort of competitive side, or maybe only sharing what people think is going to be popular, and that means then we're not covering the stuff that maybe is important. But the bit I always say is, if people aren't advocating and sharing their story, even if you don't want to use the word advocating, if you're not sharing your story, then I can't function as an advocate, because I need to know what's happening on the ground now. I need to know, what's happening if you're newly diagnosed, what's happening if you're a kid with JIA these days. Because all I can bang on about is my personal experience from the 90s, and that's very dated now, and it's getting very distant in the past. So I can't do my job if people aren't sharing. So it should be, like you say, it should be something we embrace. But unfortunately, we do live in a little bit of a world where it is all about the likes and the shares and the clicks, and that can lead to that. So it's a really important point for you to raise. I think something you said earlier as well leads us nicely on to EULAR, because you said about like energy, and we're trying to manage these conditions. And I'm very much in this space at the minute where I'm a week or two away from heading out to EULAR. I should feel very fortunate, but I'm very overwhelmed. I'm trying to manage a health condition. I'm worried about if I'm going to get sick. I'm worried about the work you got to do alongside the day job and everything else. And I know once I get there, it'll be amazing. And the community and the family, if it all comes together and re-energizes me for the rest of the year. But at the minute, I'm in that sort of like pre-event sort of lull. I don't know if you can relate to that, but
100%.
Oh, good. Sorry, it's not just me. I would beat myself up about feeling ungrateful. But for anyone that isn't familiar, do you want to just maybe tell us a little bit about what EULAR is? Because it's a term they've heard me use on the show for a few weeks now, and maybe your involvement and recent new change, I suppose, in terms of involvement with EULAR.
Yeah, so EULAR is a brilliant organisation. It stands for the European Alliance of Associations for Rheumatology. That is a reasonably new name to be reworded basically from the old European League Against Rheumatism, which was a outdated reference to what EULAR does. And really, EULAR brings the whole rheumatology community together in Europe, but actually around the world. It's one of the big, pan country, pan Europe, but also they've got like the ACR in America, the American College of Rheumatology. We've got the Asian League, we've got the South American and African. So there's all the different leagues, if you wish. But EULAR is one of the leaders in advocating for everybody involved in rheumatology. And what I really, really love about EULAR is that patients aren't on the sidelines, so they treat. The scientific society is representing your rheumatologists. You've got them in sort of one pillar. You've got the health professionals in rheumatology, so nurses, physios, OTs, mental health teams, social workers, all in the health professionals in rheumatology pillar. And then you've got PARE, which stands for people with arthritis and rheumatism in Europe. Essentially a little bit outdated, but it does what it says on the tin. It's the PARE, and there's a real identity to the PARE, so that's why that name sticks so well. And it is the people with RMDs, rheumatic and musculoskeletal diseases, and that's the third pillar of EULAR. And that's really how they view how rheumatology research and care should be done with all those people together. So EULAR does lots of work. So as we know, we've got the Congress coming up. So that's one of the big events that EULAR hosts every year, the annual European Congress of Rheumatology, usually end of May, beginning of June, in a different European country. And that really brings everybody together for lots of exciting discussion, networking, poster presentations, oral presentations. The list goes on, and it is a really exciting week. But that's a lot of people just think that's what EULAR does, but it's not. They have different committees. So there are sort of topic committees. There's research, quality of care, and then there are the communities as well. So you've got the paediatric community committee. You've got the health professionals of rheumatology. You've got EMUNET, which is the young rheumatology and research community. And then you've got the PARE committee. And so really through the PARE committee, that's what aside from the project I mentioned previously, which was one of the recommendations. So they had, as a separate string, they had these task forces which developed recommendations for various different topics. So transition, there's one vaccination, on patient involvement in research, lots of different recommendations to help guide research and care that's delivered. But within the PARE community, I got involved after hearing about it. As you do a bit of research. I'm on this task force, the transition. Okay, what do they do? And they were recruiting for the members for young PARE. So this is 10 years ago now. And they were recruiting for young PARE. So it was 18 to 35. And they wanted to try and expand the work that PARE does to focus on young people, because that was an unmet need that had been identified in some previous research. So, how could this go? So I applied, and I managed to become a founding member of Young PARE. So that was really exciting to actually, okay, this is when my advocacy is, growing in the UK. I'm actually now stepping a foot and starting to do international advocacy. So that was that first interaction. And I remember meeting the team in, I think it was March 2015, and we had a meeting in Zurich to sort of do terms of reference, co-create all that kind of, all the important stuff when you're running a group. So then that was great experience for me. But then to meet like these other young people from different countries, to hear their experiences, really making you realise how lucky we are in the UK to have a health service where you can have access to treatment. All these things which you do not think about when you are in your little bubble. And really, as you do, one thing led to another. So I ended up applying in more different task forces, and being invited to speak at the EULAR Congress, being invited to speak at the PARE conference. So that's like a separate conference, usually later in the year, which is on a specific topic for all the different patient organisations in Europe. So I started being invited to those, and then I was asked to join the at the same time I transitioned to do my PhD as well. And I was invited to join the young research community. That's how I'm a patient. It's like, it doesn't matter. You can be both. I was one of the first times where it's like, oh, I can be, because most people, it's like we have to pick, you're either a researcher or you're a patient. Actually, no, I am a patient researcher. And so I joined that immuno group for 3 years. And I don't know, there's something very, very special about the European rheumatology community, because all the, especially the young researchers, like they are 100% switched on in terms of, patients involved. We do things together. I remember, sitting down with Eleanor from London and Paul from Vienna, and 2 young rheumatologists. And we had this idea about actually patient-reported outcomes don't really address what's important for young people. So, Joel, I'm sure you remember completing the chat questionnaire where, can you open the door? Can you open the jar handle? Do you do like domestic duties or whatever? I can't remember the exact wording, but all those things where it's like, what sort of young person actually does, like domestic duties?
I just want to kick a football with my mates or whatever.
I can't hold my phone, or I can't, I can't operate the remote, or it's all those kinds of things. And so we were chatting about it, and it's like, all right, well, let's do something about it. And so we applied through a grant, and we created some recommendations for young person-focused patient-reported outcome measures. And there was just an example of that. Literally, that is how easy. Let's get together. Let's talk about something. Let's do something together with our combined expertise and knowledge of where we can get funding. Let's do something. And we made it happen. And that is what I love about the EULAR community, because there is that want to do things better, to do things differently, and to admit, okay, we've maybe not done things very well historically, but we can do things differently now. So that's what I love about that. And I just love everything that they stand for. Patients are embedded in every level, up to the vice president representing PARE. So, on the highest level of authority at EULAR, you have patient representation. And to me, no matter what organisation we are in, if we don't have patient involvement at that level, somebody with lived experience, you truly never get that filtering down. We can do so much grassroots, but it's got to be a top-down approach as well, because without leadership buy-in, you make zero headway on where we need to be.
I'm clipping that, and I'm going to go around the UK in a minibus with a loudspeaker on the top, and because that's as somebody that got into sort of global advocacy like yourself, I find like you get a bigger appreciation, don't you, where the challenges are, and as much as I sort of wanted to help back home, I sort of realised, well, actually, it makes me a much better advocate and a person, a human being, if I can understand that, okay, this is a challenge in this part of the world, and this is a challenge in that part of the world, and that having lived experience at every level, including the top, that is something I've really opened my eyes since I've started doing this on a global level, and realised there's certain pockets. I'll be very careful with my words that I've really got to learn from that. So I think all of that stuff you just said is brilliant, and I have not heard a better and more passionate explanation for EULAR than everything you just said there. So thank you so much for sharing. And I did notice you didn't share that you're now chair-elect, I believe, for that.
No, I didn't get onto that.
No,
I can talk for England. So.
No, you're so passionate about the organisation and the body. It was amazing.
Forget about me.
You went away from personal. Yeah, so let's talk about Cyber for a little bit. And tell us about that.
Yeah, so I've been on the PARE committee, and so I came off Young PARE after my term ended, then joined the PARE committee, which is the adults group. Anybody not in the 18 to 35, I still fit that category. But I joined the PARE committee because it was a natural progression, and that for me is what it's all about, like equipping younger people with the skills and knowledge to be able to know, okay, I know a little bit about research, know a bit about that. I've got more confidence, and I want to do more. So that's what that natural progression for me is always so important. So I joined the PARE committee a couple of years ago, and then an opportunity came up last year where, so the current structure is there's always the chair, and then there's either a past chair or a chair-elect. So current chair is Peter Boyd from Ireland, a great guy. I've had the pleasure to work with him for a number of years. And the current past chair is Susie McAree from Cyprus. Again, Susie's hugely experienced within our world of rheumatology and patient involvement. And so the opportunity came up, and so I believe that I was nominated. So I didn't put myself forward. So I nominated a few people. and then got in. The team from EULAR reached out and said, would you like to apply? And I did debate it because it's not. I can't do anything half-heartedly, and I had to think. Okay, I've got a full-time job. I've got my health conditions. I've got all my other advocacy as well. I care for my dad as well at home. And I've got all these. I'm trying to live a life as well. That little thing on the side.
I think you just take all you do involved in advocacy, and I'm already thinking, how do you fit it all in? Life is important, Simon, as well.
It is. And I was debating it. I was like, well, I'm not going to get this opportunity necessarily again. And I was like, do you know what? Let's do it. So I applied, and in March I got an email to say the EULAR board met and that they had elected me as the chair-elect. And I remember just looking at the email thinking, did that just happen? And I didn't get just like the email. I was like, oh, okay. And then people started to message me from EULAR afterwards saying, congratulations. I was like, oh, this is real. So it is very, very exciting though. And, I guess my leadership style is all about, there's no, leader at the front. It's all about we do things together. We have those ideas. I've got my ideas, which, I will be communicating what I want. And it's all about patient involvement at every step. It's all about young people. It's all about those people who are, described as hard to reach. No. We just need to reach them. People who are not included in the conversation. That is going to be my priority, and to do things in a truly integrated manner. So that's my approach, which is not probably no surprise whatsoever. But no, my term officially starts after the EULAR Congress. So I have 12 months as chair-elect. So I get to learn from Peter, from Susie, the current past chair, and then Elsa, who's our vice president representing PARE. Do that for 12 months, and then from 2025, that's when my term as chair for 2 years happens, and then I had 1 year as past chair, so it's a 4-year term. I'm just very, very excited to be doing that. And it'll be great for me to reach out to more of our UK organisations under our member organisation, which is ARMA, the Arthritis and Musculoskeletal Alliance, to look at what more can the UK do within EULAR, because sometimes I think there's more we could be doing, because I know there's amazing work that's happening. So that's going to be one of the other things. How do we celebrate that? And working like the EULAR team, so the EULAR PARE committee, supported by Becca and Berta, and they are two amazing, committed individuals who have decades of experience. So it's a really well-oiled machine. There's a great committee, and what I love about going to EULAR is that we call it a PARE family, and I genuinely mean that. Is I feel cared for by the PARE community. And I think that is such a lovely, lovely experience to have that. Actually, the work that we do, it is work, but it's not work when you are having a lovely time with people who genuinely care, who understand what it's like, and we get on and do things. And there's something so uplifting about that. And to me, it's about we need to be demonstrating how amazing this is, because that will inspire other people to think, I want to do patient advocacy. I have a role to do here. And that's what I want. I want more people on board, more people involved, and more researchers to realise we're going to have to watch out, because the patients are going to be taken over otherwise.
and how you can actually do real work. I think, over the last couple of years, I think the pandemic didn't help, because lots of accounts, things popped up. People got very confused and thought advocacy was, social media posts of injections or whatever that might look like, or getting on a bandwagon about a certain medication, and it kind of got lost in that you can actually be hands-on doing real work, and I think you're such proof of that. It's just, your journey is just amazing, and I don't feel like we're even scratched the surface on it yet. This new news, we're definitely gonna have to get you back, because I've already seen we're overrun, so thank you for giving up more of your Sunday night. But yeah, I don't think I've done a show where I've smiled as much. My cheeks ache, Simon, it's just because everything you say is my language, but also it gives me hope for the future. And if it gives me hope for the future, hopefully it gives other their hope for the future, that we really are seeing a sort of change in terms of patient involvement and lived experience. And just, big thank you from me and on behalf of the audience of leading the charge on that, because you've certainly been, my inspiration. I'm not on here every week saying that to everyone. Genuinely, my wife, who's in chat at the minute, we are to vouch for that, you lit a spark in me, and the fact that 5, 6, 7, whatever years later it is, you're still thinking, oh, if someone's doing that, I can do more. And it's mad. So massive thank you. I can't thank you enough on behalf of the patient community.
No, not at all. And I every time I see what you're doing, I'm like, how does he do it? How does he do it? And I think that you inspire me as well. and that is what keeps us going. It's the inspiration from our community, and I have to say, and I'm not even touched on the work I do as a medical communicator.
No, you're definitely coming back. I've intentionally left a big chapter out because I've got an excuse to reel you back in. You can't say no.
but I think that is, I get to work in the pharmaceutical industry, and I'm also on. There's so much you can do outside, and then sometimes you need to go in and start to change things from within. And when you are within, you begin to realise, from the outside you can say, health system's bad, industry's bad. Actually, the people that I work with day to day have a genuine passion. And there's some of the, it's navigating the red tape, it's all those kinds of conversations. But it really helps when you've got people inside saying, okay, this is what matters, this is what's happening in the real world, here's what you need to do. And then helping them to do that. And that is what we are. We are the bridge. We are the bridge between patients, between health professionals, between professional societies, between industry, between regulators, policy. We can't necessarily do everything. If you can, amazing. But it's all about what we do together. But we are that link because we provide, as advocates, we provide that bridge and that different perspective. So I just really wanted to touch on that. But I think we'll have to come back and talk about medical communications on a different chat, because that's a whole nother world. But again, it all comes back to actually making information, making research accessible and relevant to people with lived experience. And that's what I do day to day, alongside all the advocacy work. But that's for me, it's what it's all about. Health should not be for the privileged. Access to information should be not to those individuals. It should be accessible to everybody. And that's knowledge is power. So when you get things in the right format to people, that's when they begin, that light bulb comes on and they think, okay, I can live with this condition. I can do what I need to do to be able to cope. And then, so the next step, right, what can I do to make a difference? What can I do to change things for the better based on my experience?
Amazing. I think, and everything you've just said there just shows anyone who was wondering how come you're involved in so many things and get asked to do so many things, right there, you've just, not only have you given the best explanation of what EULAR is I've ever heard, that bit there, I'm going to be clipping this conversation for all year because of the amount of little sound bites that you've given us. So I really appreciate your time. I know we've gone over, so thank you for that. I will be recording a certain podcast when I'm in EULAR, so if you don't want to get collared again within 2 weeks of giving me some
happy to be collared.
avoid my booth because me and my recorder will be there. But if you want to come back, that'd be great.
Absolutely.
And if you'd like to come back and we'll talk about your medical communication work, which I know you're obviously a specialist of as well, which we didn't quite get onto tonight, that'd be amazing. Have you got anything else you want to say? Any sort of final messages? Let people know where you are. We have got people sharing links in chat who are watching this live. I'll be on screen as well where people can find you. But is there anything else you want to say whilst you got the time?
All I would say is, the people who are listening, just reach out. If you want to get involved in any type of patient advocacy, reach out. My conversations are always open. I might not reply straight away. I try to do my best. But we are a community. We are here to support each other. So if you just had an idea of, okay, maybe want to do that, reach out. And, we've all got so many contacts. There's lots we can do together. So I would always say that never feel isolated, even if it's just to have a rant. I'd always got a listen near. But I think it's just so important that people realise this, this world of advocacy is not for the privileged few who have worked to be in that position. Yes, we have worked, but everybody has a right to be there as well. And for me, that is all about bringing up the next generation of advocates as well, because it's good to have fresh blood, it's good to have fresh perspectives. And, like I say, my lived experience is still happening, but a lot of it is from many, many years ago. So we need those new perspectives constantly being included to make sure everything's relevant for the people of today.
Absolutely brilliant. Simon, thank you for being an amazing advocate, a brilliant guest, and an even better friend to me over the years. I really appreciate it. And I look forward to finally meeting you in person. It shouldn't have taken this long, but there was a pandemic in the middle of it. I'm very much looking forward to meeting you in person in a couple of weeks' time in Vienna. So until next time that you're inevitably back on this show, look after yourself, and I hope your health plays ball as best it can, and we'll speak to you soon.
Yeah, thanks so much, and see you next week.
Thank you so much. Bye.